Good afternoon, Team COTA. Thank you to everyone joining us today for our virtual town hall with Dr. Maishika Roberts. I understand we have team members watching live from our break rooms, from computers, from phones, and regardless of how you're joining us today, I just want to say it's nice to be with you for a few moments. It's really hard to believe that today marks the first day of March. Spring's around the corner, and we're now 1 year into this pandemic. So much has changed in all of our lives in the past year, but what has not changed is our team's commitment to one another and to our community. As you know, our team is unique and our people are special. Transit services have run every single day in Central Ohio during the pandemic. We have team members on the front lines and behind the scenes, ensuring that those who need us in our community, those who are most vulnerable, have mobility access during this critical time. So we've now entered into a new stage of this pandemic, now that the COVID-19 vaccine is becoming more readily available. And understandably, there are a lot of questions and even concerns about the vaccine. And I want to make sure our employees receive accurate scientific information from trusted health experts. So we are excited today to have Dr. Maishika Roberts, the Health Commissioner for the City of Columbus, join us virtually to answer Q&A that were submitted through our employee resource groups. Dr. Roberts has a prolific 20-year health background at the public level, also at the local, state, and national levels, where she has dedicated her life to public service and to protecting your health. Prior to her appointment as the Health Commissioner in December of 2017, she was the Medical Director and Assistant Health Commissioner at Columbus Public Health. She also built a solid foundation in public health early in her career by investigating outbreaks in Ohio for the Centers for Disease Control and Prevention, and has also led clinic and prevention efforts in Baltimore City Health Department. And I hope you will join me in thanking and receiving Dr. Roberts today for spending some time with Team COTA, taking time out of her very important schedule. And with that, Dr. Roberts, I'd like to turn the mic over to you.
Well, thank you so much, Joanna. I appreciate that introduction, and I appreciate the time with all of you this afternoon to talk a little bit about COVID-19. I reflected to my staff earlier today that it was exactly a year ago, to be exact, I think it was March 3rd, that I woke up and had this epiphany that the Arnold should not take place in our community. It's amazing what has transpired across the nation in the last 12 months and the work that has landed on not only us in public health, but you all. And as Joanna mentioned, you all have been there every day. There is no way to do transit remotely. And I appreciate you all stepping up and taking on that extra responsibility in the midst of a pandemic. So today I have some slides I'm going to walk through with you. I know you probably have lots of questions about COVID-19. I'm going to give you a little background of where we are as a community with COVID-19, and then I'll jump into some of the vaccine questions. So I'll take the next slide, and this just shows you where we are with our numbers. If you aren't aware, Columbus Public Health has jurisdiction over the city of Columbus as well as Worthington. So this slide, you see Columbus jurisdiction, and then you see county-wide jurisdiction. County-wide jurisdiction would be all of Franklin County, which would include Columbus and Worthington. So I'll just focus on that because that's really what we're all concerned about, because this virus knows no boundaries between Franklin County and Delaware County, or the city of Columbus and the city of Dublin. So countywide, we've had close to 120,000 cases. Of those, we've had over 1,200 deaths, which gives us a mortality rate of about 1%. You can see there that about 3% of our cases have required hospitalization. The gender breakdown is pretty equal to male and female, and our cases have ranged to as young as a few months old to 107 years of age. I'll go ahead and take the next slide. You've heard a lot about the disparity with this virus and how it has disproportionately impacted people of color. So if you want a quick refresher, African Americans represent about 29% of the Franklin County population. Hispanics represent 6%, and Asian Americans represent 6%. If you look at our cases, again, non-Hispanic whites represent 36% of our cases, Blacks 20% of our cases, and Hispanics 8% of our cases. But then when we look at hospitalizations, you see the disparity. African Americans represent 38% of our hospitalizations. Again, we only represent 20% of cases, and we only represent 29% of the population. Hispanics represent 9% of the hospitalizations. So there's a definite distinct disparity there with our African American population as well as our Latino population. And you see some of that again when you look at deaths. I'll go ahead and take the next slide. This slide shows you the breakdown by age, and it's been pretty consistent since the beginning of the pandemic that the 20 to 29-year-olds represent the majority of our cases. There's several explanations for why that could be. Obviously, the most obvious is that they're the least likely to probably follow public health recommendations. They're also more likely to have jobs that require them to be in person and not work remotely. And they've probably been the least likely to slow their lives down and limit their exposure to others. But you can also see the age breakdown for the other groups here as well. I'll go ahead and take the next slide. So let's get into the vaccine and let's talk about the prevention of COVID-19. Up until about 2.5 months ago, we were telling you all we could do is wear our masks, wash our hands, keep 6 feet apart, and avoid large crowds. And now we have a new tool in that toolbox, and that new tool is a vaccine. At the end of December, we got emergency use authorization for both the Pfizer and Moderna vaccine. And just over the last few days, we got emergency use authorization for our third vaccine, which is the Johnson & Johnson vaccine. I say that to say there is hope that we will get back to some sense of normalcy sooner than later with the addition of these vaccines. But we still need to continue to wear our masks, wash our hands, stay 6 feet apart from others, and avoid crowds until we get more people in our community vaccinated. So I'll go ahead and take the next slide. So let's talk about some of the benefits of vaccine, other than the fact that it's our tool to get us back to some sense of normalcy. The vaccine is very safe and effective. All 3 of the vaccines that are now on the market are safe and effective. The vaccine helps you from getting sick from COVID-19. The vaccines are 100% effective at reducing mortality from this virus and reducing hospitalization from this virus. But there is a chance you could get sick and have some mild symptoms from this virus if you are exposed after you're vaccinated. And there is a chance that you could still shed the vaccine or the virus to others who have not been vaccinated. But the vaccine is a safe and fast way to build immunity and protection. It's much more effective in building immunity than the natural virus itself. And it's it's one of the most important tools we have to stop this pandemic and to return to some sense of normalcy. So I encourage everyone, when it's your turn to get vaccinated, strongly consider getting vaccinated to protect you and protect those around you. I'll go ahead and take the next slide. I want to spend a little bit of time to dispel some of the myths that many of us have heard or that are circulating out there about the vaccine. So many people think the vaccine is a live virus, that it actually contains COVID-19 and it'll give you COVID-19. That is not correct. It does not contain COVID-19. It's not a live virus. It will not give you COVID-19. It gives you a mechanism to detect COVID-19 if your body encounters it in the future. It also does not cause you to test positive for COVID-19. It does not give you antibodies for COVID-19, and it does not make you test positive for COVID-19. It is built, the Pfizer and Moderna vaccines are built on a messenger RNA platform. They do not alter your DNA. Your DNA is there, no one can touch it, it is solid. The messenger RNA is a tool to help us get into your cell so that we can code proteins in your cell that can respond to the virus if it were introduced to the virus in the future. This vaccine, the 2 vaccines that we know are on the market and the Johnson & Johnson do not contain fetal or human cells. They do not contain pork or animal products, and they do not have a tracking device. If the government wanted to track any of us, they would use our smartphones. That's how they would track us. They would not try to get individuals vaccinated to do it. That is a very ineffective way for the government to try to track us. So let's talk about the process of getting a vaccine approved or getting it emergency use authorization. Usually that process can take anywhere from 8 to 11 years. So you might ask, how did it move so quickly? Well, there's a few different reasons for that. First of all, COVID-19 is a virus that is caused by a coronavirus. There are other coronaviruses that have circulated in the world prior to December of 2019. They caused diseases like SARS and MERS. I'm sure all of you remember hearing about MERS and SARS. They're also caused by coronaviruses. So researchers and scientists from around the world have been very familiar with coronaviruses and have been studying them for decades. Compound on that they had also been studying messenger RNA vaccines and how they could be created. So let's fast forward to December of 2019 when we heard about this virus from Wuhan, China. Scientists from around the world knew, oh, it's related to SARS and MERS. Oh, we know a little something about this virus. Oh, we see this virus is circulating and easily transmissible from human to human. We know this is going to cause a pandemic, and the only way to stop this pandemic is to get a safe and effective vaccine. So once what I like to call the fingerprint of the COVID-19 virus was identified in January of 2020, scientists from around the world got to work and said, okay, let's compare this to what we already know about other coronaviruses like SARS and MERS. We've been studying this mRNA vaccine platform. Let's see if we can get an effective tool that will stop the spread of this virus with knowledge that we've known about and we've been researching for years. As a result of that, they put together some vaccine products. They started studying it in the lab, and then they started studying it on humans. One of the things that makes the process for vaccine approval take so long is some of the red tape that's involved. And the government did their best to eliminate some of that red tape. And usually that red tape is just, you have to get in line, and whatever is ahead of you, you just have to wait for them to get approved and them to go through FDA before your product can go. But we're in the midst of a pandemic. And so FDA agencies around the world said, we're not going to make people wait in line. We're going to put this vaccine ahead of the game. In addition to that, phase 1, 2, and 3, which is when we really try the product on humans, usually go back to back. So phase 1 can take 6 to 18 months, if not longer. Phase 2 can take another 6 to 18 months, if not longer. What they did is they did phase 1, 2, and 3 concurrently, each of them lasting about 6 months, but concurrently. Instead of waiting for phase 1 to be done and starting phase 2, they did them all at the same time. So it was a combination of having a lot of information and knowledge about coronaviruses prior to December of 2019. It was a combination of having a lot of knowledge about this messenger RNA vaccine that doesn't grow on egg cell lines, so it doesn't take time for it to grow and mature. And then compounding, or really collapsing, the research into doing it concurrently instead of back to back, and then asking FDA if they can go to the front of the line instead of waiting for their turn to get that emergency use authorization. So no short steps were made, no safety measures were eliminated to get this vaccine on the market that quickly. But I think that background information is important for people to understand. It went through all the phases, they just happened concurrently instead of back to back. I'll go ahead and take the next slide. So just reiterating, the vaccine is safe and effective. Vaccines are held at the same safety standards as all of our vaccines. Safety is always a priority here in the United States. That's why you might have heard of some products being used in other countries, but not being used here yet, because those manufacturers know they don't have enough information, they don't have enough safety data for the FDA to grant it any type of approval, even emergency use authorization. So my next slide is a little bit out of date because in the last 48 hours, we have received emergency use authorization from Johnson & Johnson. But let me just tell you a little bit about the Johnson & Johnson vaccine first. It's a one-dose vaccine. The other two vaccines are 2 doses. The Johnson & Johnson vaccine is approved for anyone 18 years of age and older. The Johnson & Johnson vaccine is not an mRNA vaccine. It's an adenovirus vaccine. It is 100% effective at reducing death from the virus called COVID-19 and from reducing hospitalization from the virus called COVID-19. You see there the Pfizer and Moderna vaccines are 2 doses, Pfizer being 21 days apart, Moderna being 28 days apart. The Pfizer is approved for those 16 years of age and older, Moderna 18 years of age and older. You see about the 95% effectiveness and the 94% effectiveness. That data is based on the original COVID-19, not based on the variants that have been identified recently. And again, both of those vaccines are 100% effective at reducing mortality or death from COVID-19 and 100% effective at reducing hospitalization from COVID-19. So just some things to keep in mind about the 3 vaccines we have on the market now. Let's go to the next slide. Let's talk a little bit about Ohio's phased approach to distributing the vaccine. Early on, we're in phase 1 because supply of the vaccine is still very limited. I'm very optimistic that by the end of March, we'll be in phase 2, if not sooner. The first phase that we introduced for phase 1 was phase 1A, which primarily consisted of healthcare workers who are on the front lines and those living and working in congregate care facilities. Those could be nursing homes, those could be treatment facilities, and they could be homeless shelters. From 1A, we moved to phase 1B. Phase 1B consists of individuals over 65 years of age, our K through 12 educators, as well as those who were born with medical conditions. As supply increases, again, we'll move on through the phases and more people will be eligible. Any vaccine provider in Ohio has to follow this phased approach that the Ohio Department of Health and Governor DeWine have outlined here. So go on to the next slide and I'll tell you a little more specific about where we are. Primarily, we're focused on phase 1B right now because vaccine supply is limited. We did just find out that we are getting 300 doses of the Johnson & Johnson vaccine this week. If you live or work in Columbus, you can get vaccinated at Columbus Public Health by going to columbus.gov/coronavirus or calling us at 614-645-1519. If you want up-to-minute vaccine updates, we can text them to you if you enroll in our text program. All you need to do is text the message VAX-CBUS to 888-777, and we give you a text message when we're going to open up registration, when we've expanded registration for different groups. So that's a useful thing to do, particularly if you live or work in the city of Columbus or Worthington. And then if you want updated information about other vaccine providers outside of Columbus Public Health, but within the state of Ohio, go to vaccine.coronavirus.ohio.gov. I'll go ahead and take the next slide. This slide's a little bit out of date. I've got some updated numbers now, but as of close of business on Saturday, I had vaccinated, well, not I, Columbus Public Health had provided 42,000 vaccines, of which about 15,000 were second doses. This is just what Columbus Public Health has done. There are other vaccine providers in Franklin County, including Franklin County Public Health, our 4 hospital systems, and then pharmacies like Giant Eagle, Kroger, and CVS's also have vaccines. So this is just an indication of what we've done at Columbus Public Health. The majority of our vaccines are being distributed at the fairgrounds at the Celeste Center. It's a drive-through. It works out quite nicely. If you've talked to anyone who's been there, most people have nothing but positive things to say about their experience at the fairgrounds. I'll go ahead and take the next slide. I mentioned early on about the disparities with the disease activity, and we, all saw and you've heard on the news, the local news, the national news about the disparities. We've also seen a disparity in vaccine uptake, where African Americans have been less likely to get vaccinated. And there's some reasons for that vaccine hesitancy. Some is mistrust in the vaccine process, the government, and healthcare. A lot is misinformation, some of the myths I shared with you earlier. A lot is access. You know, for an example, our hospital systems are notifying their patients if they're eligible for the vaccine, if they've sought any care at one of our hospital systems. But the way they're notifying people is sending them an email through their electronic health record. We know that not all African Americans have a healthcare provider, and if they do, it might not be through one of our hospital systems. Not many African Americans have email that they use regularly, or they don't have internet access. And then we can't deny the fact that there's this historical mistreatment, whether you look at the Tuskegee study, whether you look at Henrietta Lacks. And what I remind people is sometimes you don't even have to go back that far to see the mistreatment. You can just go to the last time you sought healthcare as an African American and you felt like you got poor treatment. So vaccine hesitancy is real. We must acknowledge it. And what I always do when people say I'm reluctant to get the vaccine, I ask them why. And, you know, it's personal for everyone. Everyone has a different reason, but I ask them why, and then I try to respond by telling them why their rationale might not be 100% accurate. I'll go ahead and take the next slide. As a result of this disparity, Columbus Public Health has created a vaccine equity priority plan. It's a three-prong approach: increasing access, removing barriers, and increasing information and communication. I'm making sure that we put a minimum of 20% of our vaccine supply every week, and we reserve it for our vulnerable populations. We're doing a better job of tracking race data. It's how you ask the question, it's when you ask the question. We've started a weekly opportunity clinic, which I'll tell you a little bit about more in a little bit, but we focus on different neighborhoods in Columbus that we know are vulnerable based on the CDC Social Vulnerability Index. We've removed some of the barriers by having a mobile team that actually goes out in the community and vaccinates individuals who can't come to us. We know not everyone has internet, so we've made it available that people can also register by phone. We have a call center that's open 6 days a week. And then we're doing a lot, I'll go ahead and take the next slide, on informing and engaging individuals. Trying to use a diverse community partners as influencers to carry the correct information to the community. We realize that for this information and for the minority population, we can't depend on social media, we can't depend on billboards, and we can't depend on commercials and the news. So we need a kind of a boots on the ground approach. So we need to have those conversations. I've done lots of conversations with groups like yours, with groups like sororities and fraternities, clergy, just to get the message out and the correct information out. And then we're also partnering with the City Department of Neighborhoods to engage the community and provide boots on the ground information. We're also investing the city, county, and all of our hospitals with a community-wide multimedia campaign with special focus on underserved minorities. Next slide. I just want to tell you a little bit about our opportunity clinic. You see the zip codes there. It's every Friday here at the health department. If you know someone who's eligible, lives in those zip codes, they can call us at 645-6444. It's a different number to register for this clinic. We can also help people get transportation. And then I think I'm almost done because I want to answer your questions. I'll go ahead and take the next slide. This slide just gives you some information of how to get information from us. Go to our website, columbus.gov/coronavirus. Call our call center, 645-1519. There's the information about the text updates. The state health department, which I've shared with you before. I encourage people when they want to get reliable information about COVID-19 and the vaccines, they should go to reliable resources like CDC, like Ohio Department of Health, and like Columbus Public Health. And with that, I'm going to end and I'm going to take any questions any of you have.
Okay, thank you, Dr. Roberts, for that presentation. My name is Joe Massey. I'm the Senior Project Manager here of Capital Projects at COTA. I also serve as the co-leader of COTA's Veterans Employee Resource Group. And as a veteran of the United States Marine Corps served overseas, I know firsthand that vaccines play a critical role with the United States military in keeping our service members safe. I'm extremely thankful for all the hard work our medical professionals have done with the COVID-19 vaccine and I plan on getting one when it becomes available. Before this event, we reached out to a number of our employees and our employee resource groups to gather some questions and concerns about the COVID-19 vaccine. So I wanted to take a few moments to ask the questions on behalf of Team COTA. First few questions are based upon the vaccine brands and their effectiveness. Question number one, we know that there are a few different companies that have released the vaccine, including Pfizer, Moderna, and now potentially, as you mentioned, Dr. Roberts just released the Johnson & Johnson vaccine. Do those being vaccinated have the ability to choose the brand of vaccinations they receive? And what are some of the known side effects known from each brand?
Sure. So up until now, we did not, and I say we, meaning really all vaccine providers in Franklin County, did not give people a choice of which vaccine they got. We just said, this is the vaccine we're offering. Both of the vaccines up until now were a 2-dose vaccine. So we didn't feel that that was necessary. Now we realize that we need to give people a choice to see whether they want the 2-dose or the 1-dose, assuming supply is there. So for example, this week I'm getting 4,800 doses of vaccine that are Pfizer and Moderna, and I'm getting 300 doses of Johnson & Johnson. So if there's a significant demand for Johnson & Johnson, we're going to go through that supply pretty quickly. And when individuals come to us, we might not have any more Johnson & Johnson. So I think all of us, all of the vaccine providers are going to do our best to provide options as vaccine supply exists. In terms of side effects, I was on a call the other day, and I kind of want to get away from side effects to talk about reactions. The side effects or reactions that individuals have after getting the 2 vaccine products that we know of right now, the Pfizer and Moderna, are common. Side effects are common, so I hate to call them side effects. They're really just a reaction. And we've seen them with both the Pfizer and Moderna. They consist of fever, body aches, headache, fatigue. Those are the most common ones. They usually happen after the 2nd dose. They usually happen anywhere between 12 to 24 hours after that dose and last anywhere from 24 to 72 hours.
Okay, thank you, Dr. Roberts. Question 2, is the vaccine effective against the newly discovered strands of COVID?
So the early indications we have are that the Moderna and Pfizer vaccine have some effectiveness against the new strains. They might not be as effective against the new strains as they are against the original strains. Now, the difference is the Johnson & Johnson product was going through clinical trials in South Africa and in South America while these new variants had already been identified. So the fact that the Johnson & Johnson vaccine survived that and was still effective with those, there could be some theory that the Johnson & Johnson vaccine is more effective than the other 2 against the new variants. But they're all give some protection against the new variants. We're still trying to figure out exactly how much protection against the new variants.
Great information. Thank you, Dr. Roberts. This next question 3 you covered a little bit earlier. Once you receive the vaccine, are you still able to spread COVID-19?
So we don't know the answer to that. Initially, we were told, yes, you could shed the virus. You wouldn't get sick, but you could shed the virus. Now there's some new data that says maybe you don't spread it as much as we initially thought. But until we get to that herd immunity, until we get to almost no cases of COVID-19 reported in our community, it's going to be important that vaccinated people still continue to wear a mask and still continue to practice social distancing. That being said, if you're in a room or in a household or having dinner or what have you with people who you know everyone's vaccinated, in that setting only can you reduce some of those barriers safely.
Thank you, Dr. Roberts. Question 4, how long does the COVID shot last? Is it like a flu shot where it's something that we have to get annually?
So that's a good question, and one that we don't know the answer to either. So again, these vaccines were given emergency use authorization because we only had about 6 months of data on these vaccines. We don't know how long the immunity lasts. We know that a vaccine provides more immunity than natural infection, but we don't know. And so we're going to learn together and find out. We anticipate this will be a vaccine that we will need annually.
Thank you, Dr. Roberts. This next round of questions, question 5 and 6, are based around general vaccine concerns. Question number 5, what are the vaccine recommendations for those who are pregnant? And does the vaccine impact a woman's fertility or ability to get pregnant?
Another great question. There were no pregnant women in the clinical trials. That being said, there were no pregnant women enrolled in the clinical trials. That being said, there were some women who got pregnant during the course of the clinical trial, and they had no negative outcomes, no adverse reactions or outcomes as a result of that. The American College of Obstetrics and Gynecology does recommend the vaccine for pregnant and breastfeeding women, but that's a woman's decision. And I encourage them to talk to their healthcare provider if they have any reluctance of getting vaccinated. And there's no data that supports that the vaccine could cause infertility.
Okay, thank you, Dr. Roberts. Question 6, why is the vaccine not recommended for persons under the age of 18? And do you think it will become available for kids or teens?
Right, so there weren't enough youth, so to speak, enrolled in the clinical trials to know if it's effective under that age. And so that's why it's restricted to the 2 vaccines are restricted to 18 and older. They are doing some studies now on older kids, so that 12 to 18 group. We're optimistic that some of that data will be released and they'll be allowed to get vaccinated maybe in the fall. And then we're looking at 2022 before our younger children could get vaccinated. So it really just has to do with the fact that they weren't in the clinical trials at the beginning, and we need more data on that younger age group.
Thank you, Dr. Roberts. These next round of questions 7 and 8 are based upon eligibility. During a press conference last week, Governor DeWine indicated that the state will add eligibility of age groups decreasing by 5 years, with the next group starting with ages 60 and older, then moving to 55 and older, et cetera. While we are hoping that the state will also add transit workers to the list of eligible groups in the next round, how do you recommend our employees access the vaccine if they're age eligible?
So if your employees are age eligible, I suggest they go look at their website of their local health department. All of them are employed at COTA, so they could be eligible for Columbus Public Health because they work in the city of Columbus. We put that information on our website, columbus.gov/coronavirus, or if they want to go to their health department where they live, that's also available, again, if they're age eligible.
Thank you, Dr. Roberts. In the current 1B phase, there are certain pre-existing conditions that allow individuals to be eligible for the vaccine. Can you share more about what those conditions are?
Sure, I have my little cheat sheet because I forget them. There's lots of them. So these are primarily health conditions that individuals were born with. So cerebral palsy, spina bifida, severe congenital heart disease that has required hospitalization within the last 12 months, severe type 1 diabetes that has required hospitalization within the last 12 months, inherited metabolic disorders like PKU, severe neurologic disorders like epilepsy, hydrocephaly, and microcephaly, severe genetic disorders like Down syndrome, Fragile X syndrome, Prader-Willi syndrome, Turner syndrome, and muscular dystrophy, severe lung disease, including asthma that has required hospitalization in the last 12 months, sickle cell anemia, alpha and beta thalassemia, and recipients of solid organ transplants.
Okay, thank you, Dr. Roberts. Last question, and this is regarding post-pandemic world. Our final question is around what life may be post-pandemic. In an ideal world, with the goal of majority of the population being vaccinated, do you think we can ever return to life as it was pre-COVID, meaning no masks and returning to sporting events and large gatherings?
So yes, I do think we will return to life pre-COVID with activities, but I think there'll be differences in how we engage in those activities. So there may be something where, you know, your temperature is checked before you go into a football game or an arena. There may be things where you're expected to have a vaccine before you travel abroad. So I do think we will get back to life pre-COVID. I don't see masks being with us forever, but I do see masks being with us for at least another 6 to 12 months. And I do think there'll be more people who will be wearing masks when they're in large crowds, or when they're on planes, or things, or during, you know, respiratory season there, November to March. So I do see some things continuing, but we will get back to, you know, filling up the shoe and having football games. There just might be some different expectations, some screening procedures before we get into the arena.
Okay, thank you, Joe, and thank you, Dr. Roberts, for joining us today. We hope that all of you found today's event to be educational and informative. If you missed any portion of this town hall, we have recorded it, and we will be sharing a web link in this Thursday's edition of COTA Keeps Rolling. Right now, some of our employees have been eligible to receive COVID-19 vaccine due to their age, but please know we are continuing to advocate to our state elected officials to ensure all transit workers are included in the next phase of vaccine eligibility. If you have any questions about whether you're eligible, whether that's age or pre-existing condition, we encourage each one of you to reach out to your doctor. And for those who are considering whether or not to get the vaccine, just know that you still have time to decide. Any medical decision you make is a personal choice, but we also want you to have the facts so you make an informed decision. And I wanted to close with a few reminders of internal protocols and resources to those who are considering getting the COVID-19 vaccine. Number one, COTA employees who choose to get the vaccine will receive paid time off to do so. All employees will be paid for the day that they get the vaccine and the day after for both doses. That equates to up to 32 hours of paid time off. All we need is documentation that you received your vaccine. 2, we will continue to keep you up to date on any news related to vaccine eligibility. Remember to keep an eye out for the COVID-19 update sent every other Friday. If you have any further questions, please feel free to reach out to the COTA's COVID hotline. Again, that number is 614-308-4250, or you can email vaccine@cota.com. And as always, keep doing what you're doing to stay safe. Mask up on transit vehicles and in common areas of our facilities. Mask and social distancing will help slow the spread of COVID. And lastly, thank you for your time today, and we hope that you learned more about the safety and effectiveness of COVID-19 vaccine. Thank you again, Dr. Roberts, for being with us today. Have a nice day, everyone.